My name is Karen Johnson, and I would like to welcome you to this portion of our evening event. I am joined by Dr. Marie Savundranayagam and Dr. Anna Garnett. Thank you so much for joining us. We are raising funds tonight for a project that our teams are working on together called McCormick Mobile. But before we get into that, I think it's really important that we understand the context of why are we putting forward such a project for such an incredible team called McCormick Mobile. So I'm just going to throw this out to Marie and Anna. What do you feel is lacking with dementia care in the community right now?
What's lacking with dementia care is consistent and seamless support for both persons living with dementia and their family care partners from diagnosis to after the end of life, including bereavement.
No, I would totally agree with Marie. I think particularly of note is that the sort of upstream care to help prevent situations from developing or escalating or hospitalizations happening. So providing the support that they require, as Marie mentioned, as they need it, but meeting their needs sort of in a proactive fashion. So in giving them and empowering them to learn how to manage situations before it reaches crisis levels.
I think that's a really thing to talk about actually are the care partners and the caregivers. Particularly right now with the strains on the healthcare system. We've had, we knew that before the pandemic, there was a crack in the healthcare system, particularly in community care. And now with the pandemic, it has become a chasm. And the goal of McCormick Mobile is to make sure that that chasm doesn't become a huge, Grand Canyon. So what we're seeing are caregivers having their own significant health issues. And we're seeing a lot of crisis happening. And that investment doesn't necessarily seem to be hitting the mark, being more proactive. So why do you feel that these issues are so prevalent for caregivers and care partners?
Caregiving has its own emotional challenges in the very best situations, and caregivers are coping with many, often being drawn in many directions and trying to balance their needs, family needs, caregiver needs. And I think COVID has just exacerbated that in a really, really major way. And
I think that that's the thing we see. We see a lot of the crisis happening in long-term care. It's in the media. It's always in the media. These crises are happening every day behind so many doors, so many closed doors in the community, and we just don't see it. And there aren't even the bodies, the professionals to go into the homes to even see it happening.
Yeah.
And it's interesting, when I first started working in the field of older adults and dementia care, we expected that when the baby boomers started to get to the retirement age, we would start to see a change in expectations for care and support for individuals living with dementia. And with respect to community care and long-term care, what are your thoughts on that? Because
I do think that baby boomers have made great strides, especially in terms of advocating for better care and even advocating for better care if they are persons living with dementia and if they're caring for someone with dementia. But I think the stigma around aging and stigma around dementia are still very prevalent. And we are making some strides as researchers and working with community members, but I think there's a lot more that needs to be done in terms of reducing or eliminating that stigma.
I think also is that it speaks to, again, sort of our health system approach in this country, and it's really slow to change, and a lot speaks to funding dollars and a lot about sort of cost benefit analysis. And I think it all directly ties with what Marie said about, ageism and perspectives and value that's placed on life and service delivery. And it's a very slow and difficult process to evolve forward from that.
Mm-hmm. And fundamentally, we know that people want to stay in their homes. And like you said, it sounds like things are slow to evolve with respect to that investment in keeping our older adults and people living with dementia safe and sound in their homes in the community. How does the current state of care impact the caregivers? So that lack of investment that we're seeing.
I think they feel right from the beginning it's going to be an uphill battle, and I think for some of them, it's sort of daunting even before it begins, they know they're in it for the long haul. And unfortunately, it's sort of until often services or the need for services hits a crisis point that action is not taken.
And getting that help right at the point of diagnosis is so critical. So I agree about that preventative approach. So what would be ideal is at the time of diagnosis to be immediately connected.
We are funding this as a pilot project through this event. What do you think is going to happen if it's a success? Where do you see this possibly going after this year?
It's sort of a start in providing the evidence to change policy for care delivery. Could potentially really revolutionize like how we look at care for older adults and caregivers.
So this is a new way of providing tools to caregivers, as we know that the expectations placed upon them are so high. They're expected to know how to provide personal care. They're expected to understand and provide medications. They're expected to know how to modify activities that are meaningful. So hopefully through this pilot project, through our teamwork, and through the support of the donors to the McCormick Care Foundation, we can demonstrate that this is effective, and hopefully we can roll this out bigger and better and get it out to other communities. And I love the idea of it affecting policy, because things really do have to change. The system right now is beyond fractured, and we need to come up with those creative and novel solutions that will really make a difference for everyone in the community. Thank you so much, Marie and Anna, for joining us tonight, for your insights, your expertise. I'm so excited to be working together with you on this project. It means the world. And I do hope that our viewers tonight understand a little better about the crisis that is happening in the community behind so many closed doors, but they also see that we are stepping up as a group to try and help those people so they can have a better quality of life for everyone, the caregivers and those individuals living with dementia.
Thanks very much, Karen.
Thank you, Karen.